Well, throughout this pandemic, we have seen the weary faces of those who are on the front lines, the healthcare professionals who are risking their own lives to save others.
The true heroes. Well, Vic joins us now with a conversation with one physician who is there engaged in the battle. Vic.
Well, Rick and Denise, we can only imagine what it's like for doctors, nurses, technicians, and other folks who work in hospitals who are right there on the front lines working to save lives as winning this battle against the coronavirus. Today, I talk with a Baltimore-based anesthesiologist. Dr. Bobby Burgess says that the methods for treating COVID-19 are changing rapidly, and doctors are doing all they can to simply keep up.
As you know, there are constant changes that are coming out in terms of what we are understanding as it relates to how this virus operates, what we call the pathophysiology of the virus, how it attacks people's bodies. We're constantly being inundated with new information, which then causes hospitals and governing bodies to put out new guidelines. So there's always this hypervigilance to ensure that you're actually treating patients with the most up-to-date evidence-based information.
How are you getting this information?
So most of the information that we're getting in terms of evidence-based ways in which we treat patients comes directly from governing bodies and organizations, primarily because a lot of these patients are critical care patients. Our critical care colleagues are getting this information from the small trials that are coming out.
Describe for me in the most human of terms the scene that you are faced with and other physicians are faced with every day when you go to work. What is it like?
There's just a hyper concern about protecting yourself at all times, which is palpable from the folks who clean the room down to every nurse and every physician you come in contact with. So people they're just scared.
Well, just this past weekend, we saw that a New York who herself is a survivor of COVID-19 committed suicide near her parents' home in Charlottesville, Virginia. And while that may be the extreme, it does demonstrate how emotionally draining it is for everyone who is involved in healthcare right now. By the way, Dr. Bobby Burgess has a answer questions about this pandemic. We have a link posted on our website at WJZ.com.